Dr. Ridwan Buali from Canada. I come quite often here in Nepal, in Kathmandu, and work in ICU with my colleague here in teaching hospital. I want to talk to you about severe infection. It means that the patient get affected with any bacteria mostly, and they have some clinical signs that we look at. This is a very bad disease because it may kill people, especially patients with other problems like maybe kidney problem or lung problems. So it's very important to recognize very fast this disease, and there is a standardized way to recognize it. There is a standardized way to treat it. For example, we have to give antibiotics very quickly. We have to control the source of infection. Sometimes patients may need surgery for that. So this is a very important topic because 20% of ICU patients are suffering with this disease, that we call sepsis.
Sepsis is common and often deadly, and it causes high mortality despite advances in modern medicine. Sepsis occurs when there is inflammatory mediators released into the bloodstream. This is often controlled, but when there is a disbalance between the mediators that has been released, the pro-inflammatory and the anti-inflammatory mediators, this releases the syndrome, which often progresses into sepsis, septic shock, and eventually, if this process is not controlled, this eventually leads to the death of the patient. This is a very common problem, and in fact it is more common than heart attack and cancer. But still, so many of the healthcare professionals do not have adequate knowledge about the sepsis and the septic shock. Sepsis usually does not discriminate among various ages, although it is more common in young adults usually, but the more brunt of the sepsis is borne by the people who are usually old and who have got the weakened immune system, and in those people the impact of the sepsis is the most. So sepsis usually presents with various symptoms like fever, shaking of the body, fast breathing, fast heart rates, and usually it has got 3 stages like sepsis, severe sepsis and septic shock. So our goal is to treat the person when the patient has got mild sepsis rather than when the patient has got full-blown septic shock which has got high mortality.
Early identification and treatment of sepsis has tremendous economic benefits, apart from saving lives and reducing the impact of sepsis. The treatment of sepsis often it involves the complex therapies and treatment in hospital setup usually in ICU. The aggressive treatment of sepsis improves the chance of survival in the patient. It usually involves the treatment of patient in ICU and multidisciplinary approach. The sepsis, it has been seen that the prevalence of sepsis in Nepal is almost as equal to the prevalence of sepsis in countries like United States of America, Norway and Brazil. However, it has been found that the mortality rate because of sepsis is more in our country as compared to those countries. The study also recommended that the awareness about sepsis and its management as per surviving sepsis guidelines should be mandatory to reduce the rates of mortality because of sepsis in a setup like our country. However, it is an irony that most of the healthcare professionals are unaware about sepsis in our country.
Sepsis strikes an estimated 30 million people worldwide, and many of them needlessly die or suffer major health-related issues. Sepsis is the final common pathway for most of the illness, leading from infection, trauma, surgery, or many other diseases. It is one of the most common and deadly disease, and it also strikes with equal ferocity to all the patients either in low resource countries or even in the developed countries. Education and resources are seriously required to identify, train and treat sepsis in all these settings so that sepsis can be treated early and as an emergency so that we can reduce the toll of the number of deaths caused by sepsis. Too many people develop sepsis, but very few survive. So we all need to come together and work together to change this. Let's all change this. Thank you.